And now we are going to transition to our first panel section. And I'm honored to be one of the moderators for this section. And a little bit about my background, I'm a trainer for the Lotus project. And also I am licensed mental health clinician, marriage and family therapist in California, and also a registered drama therapist. So if you want to know more about my drama therapist, come to talk to me later. I have my co-moderator, Cynthia, Feng. Why don't you come up and just introduce yourself?
Good morning, everyone. Thank you for being here with us. I'm Cynthia Feng, practicing as mental health counselor in New York State. I'm also the assistant executive director of Vision House at Hamilton-Madison House. So I'm now leading the developmental of Chinese language peer support worker training program at HMH. And I'm so happy to see our trainees here today. I also want to introduce the panel a little bit. With the panel, we can have the opportunity to hear individuals with a living experience working as a peer support worker and expert. So we are honored to have a full panelist with us.
I am Jennifer. I am a medical emergency resident. I'm of Chinese descent. I also live with a diagnosis of PTSD, anxiety, and depression. And as many of you are aware, it's not easy being an Asian American living with a mental health diagnosis. I've lived for a whole 9 years in hurdles of whether or not I should disclose and whether or not I should present myself as somebody with one. But I guarantee you there's also upsides. So happy hearing.
Hi, good morning. My name is Myung. I was in the mental health system since my age 15 years old. And fortunately, in 1998, I was involved in peer special training at CUNY Peer Advocacy Center. Since then, my recovery from mental health is beginning. However, after that, then I went through 5 different jobs, but I have a good days and bad days, and also I had a sometimes bad desire, as you know. So, and fortunately, in 2013, I hired by LMHC from Psychiatric Center, Wellbeing Clinic Outpatient unit. So since then, I was getting better and better each day. So that time, I could ask to my coworker and supervisor that I need your support, I'm having a difficult time. So I was able to ask him. But in our culture in Korea, we have a lot of bad experience asking to help. As you know, in Asian country, the cultural background, you're not hardly asked to get support. Then now, I'm having good condition in my job, so I got actually paid the red group, readiness reaction, and credit cards too. And I'm also member at Farmhouse, the clubhouse. So I go there on Wednesday and Thursday evening as a member. So far I'm doing fine. Thanks.
Hi there. My name is Yumiko. I am the Director of Access to Mental Health and Substance Use Services at the Mayor's Office of Community Mental Health. And I actually, I've been there for 3 years, but before that, I was for over 10 years at the New York City Department of Health and Mental Hygiene, overseeing as the Director of Psych Rehab Services and oversaw my team oversaw 100 non-clinical rehabilitation programs, everything from clubhouses to peer support to crisis respites, and supported employment, education support, but anything that was not clinical, basically. I have been involved in the peer support workforce development for a very long time, and providing peer support myself, and was very involved with the New York State Office of Mental Health when we transitioned to Medicaid managed care and for the first time incorporated rehab services, and one of the most popular ones being peer support services. I also was deputy director of the How We Love Our Peer Training Program, which is considered one of the top, peer specialist training programs in the world, actually. And then also worked for Rutgers University as the program director for the Academy of Peer Services, which was the training and testing center for the New York State peer specialist certification process. So originally I come from the corporate world, so I'm an oddity. But because of my mental health condition, I have bipolar disorder, I decided to transition into the mental health field of my own.
Good morning. It is a great honor for me to be here. My name is Celina. I'm a family care advocate with Hamilton-Madison at University Center. In my role, I serve as a professional bridge between families and complex systems that serve them, such as the criminal education and health services. As a family care advocate, I provide information, support, guidance to help families understand and exercise their rights, resolve problems, and access to the appropriate service they deserve. We also collaborate closely with professional mental health providers, while the psychologists offer clinical expertise. We provide lived experience to support families. This means that I have personally navigated the challenges of raising a child with social and emotional needs. I've used the first-hand expertise to help other families secure the essential services they need to thrive. So my commitment to this job is deeply personal. I am a single mother to a 13-year-old daughter with autism and ADHD. When she first diagnosed this 10 years ago, I faced a significant barrier. As a Chinese immigrant with limited English at that time, I felt completely lost. In my community, such a diagnosis often carries a heavy weight of shame and silence. I spent years fighting along with that. I felt voiceless in meeting where people were deciding my daughter's future in a language I didn't understand. I struggled to navigate a system that felt inaccessible and silent. However, through persistence and advocacy, my daughter now is thriving. Sorry, excuse me. This journey gives me an education in resilience that no textbook could provide me. It taught me that we must translate more than just language.
We must translate the whole process. And today I'm proud to work with a family and youth care support program. We offer free family mentorship and specialized support for immigrant communities. We focus on helping parents master the big systems, understand IPs, and build parenting skills and bridge the culture gaps. My goal is to ensure that these systems recognize our child's potential rather than just their problems. 10 years ago, I was looking for a guide, and today I'm honored to be the guide for others. To any parents currently feel overwhelmed, we do not have to walk this path alone. And we are here to support you with all the families. Thank you.
Thank you everyone for introducing yourself. I think some of you have already answered the first question in the discussion list. What inspired you to become a peer support worker? What made you decide to share your own lived experience? And so, my question is to also asking you, how that motivates you make the decision? Sometimes have ideas is easy, but making the decision is super hard. So, any of you have any idea, you can raise your hand.
Hi, so yeah, I'm Jennifer. Again. I think one of the biggest reasons as to why I decided to use my own experience with benefit others, both personally and professionally, I found that my circle of influence initially was really just my own community virtually. Although honestly, as we all know, that's a little difficult, right? Because nobody wants to talk about mental health. It's like taboo. Because all of a sudden it's like, wait, you have a mental health condition? Oh no, let's put her away. I don't need her here, right? But then you start realizing, there are people out there that don't know how to step forward. I'm even working with a few people in my network right now, personally, who, these are people in their 20s and 30s who don't know how to speak up because their family threatens to arrest them, get them arrested, or like they're seen as weak or crippled if they say anything about it. The fact that, they can't go out and make something of themselves presents something that's considered to be shameful. But, the minute I step in and I told them, it's not that they're doing it purposely, it's that, they don't know that they're even doing it, and that it's a mental health thing that needs support, treatment. And a lot of the time I'm just witnessing all these things where people just belittle other people and don't use person-first language, and I just find that I lived through all of that, and it's also very intriguing in the sense that whenever I talk to them, they say you have to say I'm not crazy. I say to them, I don't think you're crazy. Everything you tell me, I'm not surprised by, because you know what, I'm a living example of what you're going through right now. And there is a lot of hope on the other side of that circle. So, I think what I live for is just the aha moment at the very end, when they live through all of that, but then they could also come out the other end saying, wow, there's light, I never thought I'd make it. And I said, yeah, you know what, because I made it, I know it's possible. But sometimes you just have to be that living example in people's circle to let them see, you know what, there's somebody who here understands me. And they're not just talking to me as they're trying to get me a prescription. They're talking to me so that they will be in the battle with me. And I think that's what makes all of the difference here.
Yeah, good.
Hi, okay, my name is Myung. When I was young, the 15 years old, first time to get into inpatient and involving mental health system. And it should be second time. I was about 3 months. So almost the end, they invite me to the class. The students sit in the classroom as it is, and I was sitting along with one doctor. just next to me. And they asked me a question, you know what I mean? Yes, no, yes. I couldn't talk at all because I feel shame. Because I feel like just spread the mental disease to people. First time when I went, I was one and only the first youngest patient in that inpatient unit. But second time when I went, already there were 5 kids there already when I got there. So I feel like that was it. Then I immigrated to US. Then one event was going on for me, the controller's kind of award ceremony. Even that time, I couldn't talk. I just introduced my friends to the people. That was it. So after that, I felt so ashamed. I couldn't motivate myself. In my job, I lost just bad desire comes. Things like that happened. But fortunately, I got into Harvard training, then my recovery clinics. After that, then even bad desire, I go to the Hydro Hub and ask them, please help me. I got bad desire now, so can you help me? Then I got through along with that. So far, I got full-time job, and as I told you, full-time job at the hospital. So I've been there about 13 years so far. So, yep, that's me. Thank you.
So, a lot of people know about your support in the addiction and substance use world, AA, things like but a lot of people don't know that it exists in the mental health field. And I have to say, very honestly, peer support literally saved my life. And I was very high risk because I am a 2-time suicide survivor. So my therapist recommended that I go to a support group. And I'm like, us Asians, especially Japanese, we barely talk about our emotions at home. I'm not going to air the dirty laundry in front of 12 other people, okay? So, and she said, look, she kept insisting, and she said, you don't have to say anything. Just sit there and listen, okay? And you learn. So I went, and for a long time I didn't say anything. But then I had an epiphany. I'm listening to all these people in the group, and I just realized, well, wait a minute, 25% of the population has some kind of mental health condition. Okay, so some people are born with a blood disease or a physical disability. I was born with this, but guess what? There is recovery, there's hope, and you learn from others how they achieve their recovery, what tools they use. So when you're, I think in all cultures, but I felt a lot of shame and hopelessness, and that sort of encouragement and seeing other people in their recovery meant a great deal. So, and you could safely talk about suicide. So people with bipolar disorder oftentimes get misdiagnosed as being unipolar depressed. You only go to the doctor when you're feeling better, right? So as I started getting better, my friends were saying to me, hey, you should check out the bipolar group. They're having a lot more fun in there. What's going on? So of course when they started talking about mania, I'm like, oh man, I got that too. So I went straight to my psychopharmacologist and explained to him about my manic episodes, and he said, yep, sure enough, gotta change that cocktail 180 degrees. Because before that, I was just taking antidepressants, constantly on that roller coaster cycling, and never getting to stabilization. So that was another thing I learned. So I think that motivation that I received from peer support, I want to then give that back. And so I left the corporate world where I was making more money to helping my mother.
As I mentioned before, I chose to share my stories, be a part of their support, because I want to take the hardest part of my life and turn them into a bridge for other families. When the parents are struggling, they don't always need a medical lecture. They need a human connection. Especially in my community, where there's so much silence and shame around mental health. Speaking up is my way of saying, you're not alone, and it does get better. I don't share just to talk about my past. I use my journey as a tool to give parents the instant hope, and I get it, Lauren, that I wish someone has given me 10 years ago.
We all go through a lot to become who we are today. And congrats to being a support for other peers. So my next question actually is also related to this. Like now you have experience. Like from your experience, what are some of the special skills or like advantages of like having people who live experience deliver mental health service? Like what do they find in their experience?
In my job, I'm doing, as I told you, the wellness recovery action plan, and also the creative art school. Want to show that I give them one, then 5 consumers participate, then I got times 5. I got that back to me. So I have multi-skills such as creative art, depends on the art supplies, I can do so many things. And music also, I can play piano, violin, guitar, melodium, recorder, and harmonica all. So, and also athletic sports, I can play ping pong, tennis, baseball, softball, volleyball, so all kinds. I use my skills in my job as a creative arts facilitator. So I give them the supplies that they try to do their own way. So I'm not telling them as a professional, you should do that this way, that way. I'm not telling them. I just let them do what they want to do. So even the coloring on copy paper, just give them a chance to do by themselves. And the music portion, I go to church and I play guitar, melodium, recorder, all. So I practice with them once a week. Then on Sunday service, I pray in front of that, which I practice with. And sports. At home, sometimes I go for ping pong nowadays, but I plan to go for the other sports also. So it helps me a lot. My multi-skills helps me to recover from my mental health issues because I have my own time, I have my own idea to do, which I want, which I can, then choose what I want. So it gives me a lot of encouragement and also motivation.
So I think it's really important to use every single opportunity you can to talk about your journey. The research shows that the best way to eliminate stigma is like what the gay community did, come out of the closet and talk about your lived experience, your recovery journey, and providing hope and encouragement. And people start to realize, oh, wait a minute, people with bipolar disorder can work. They can lead a meaningful life. People with schizophrenia are not all dangerous by nature of their illness. So inevitably, I weave in the opportunity of becoming a peer support specialist. And if 1 out of every 4 or 5 New Yorkers has a mental health condition, that means everybody knows somebody who's going through a tough situation. And as an Asian, of course, the employment careers are very attached to our ego, right, and our self-esteem. So having the opportunity to work, especially women with a serious mental health condition, is a beacon. So many years ago, I went to Hamilton-Madison house and spoke to service recipients there. And they were all Asian. Some of them didn't speak English very well, needed an interpreter. And I spoke about my lived experience and my career in the mental health field. And they were just shocked. There's an Asian person, not only out of the closet, but working for the government, and talking about this. So they became very inspired about becoming a peer support specialist. And so I spoke to, I'm on the board of the Academy of Peer Services, and I let them know that it was a great need for Asian peer specialists, and that we should translate the modules, the training modules and the testing modules into Chinese, so that there is an opportunity for folks to become peer specialists. And it's great that Hamilton-Madison proactively sought out funding from the City Council to be able to actually expand that workforce, which is greatly needed.
I guess I'll share what I take away. I don't really know if I could really summarize it in any sort of skill set. It's really just, I don't know, I've learned to really embrace the experience I have. It's also something that I incorporate into my narrative when I share. And that, just like you, I didn't really want to tell anyone. I was kind of shameful, and I just kind of try to blend in with the crowd. But nowadays, I don't know, I think it's just, if you're able to just, what a professor used to say to us, if you're able to just own your position, then that is going to be far more rewarding than anything else. And I'm really embracing that. And I remember the other day I was telling somebody, and we should have same diagnosis of anxiety. And she said to me, I just don't, people don't really need to wear a man. They always just everything, just get out. I didn't think so much about it. And I told them, you know what, unless people live it, they're not gonna get it. And then I say to them, you know what's the best way to really own what you have? People tell you to blend in. You know what I say to people? No. You stick out as much as you can, and then it's those that still stand with you, they're the ones that are meant to stay. And that's just showing you, I don't know, I think I've internalized this sense of pride for what I live with. Only maybe because, hey, listen, I go through it. It's not going to kill me. I'm not about to stop doing what I'm doing. But that I think it's just how you talk to people. It's like this level of contagion that kind of spreads to people. And people start saying, wow, she's proud of what she has. I'm like, yeah, I am proud of what I have. And I'm not about to just let go of this identity because, it speaks to the fact that there are obstacles, but they're not going to stop me. So I don't know how this is going to be summarized into the skill set, but I think it's just the ability to stand up for a cause when essentially society puts a dinner on it, you're kind of standing up for that cause. Especially in a culture where, honestly, growing up, I thought to myself, oh my goodness, am I gonna live with this? People think I'm crazy. Okay, I'll stand right here. I'll do exactly as I'm told. When things are shitting away, you have no choice but to just say, you know what, I'm here, I live with it, and you want to hear my story, I'm sharing.
So being of life with two engineers and carry a mental illness diagnosis can be a evidence of resilience. And thank you for being here, sharing the experience with us. We want to talk about what is the importance to expand the workforce for a peer support worker. What is the current job market demands in New York City?
So I think, those of you who are in the mental health field probably know, certainly there's a shortage of behavioral health workers, period, in the entire country. But in New York City, there is a huge demand for peer specialists. And so we have really a crisis in our shortage for the workforce. So I want to say right now, practically every new program or service that's funded by the city or the state is requiring peer specialists in their staffing pattern. At any point in time, there are like 50 job openings in New York City alone for peer specialists. So, and one of the things that's fortunate for us is that we do have 4 peer specialist training programs that provide in-class didactic training. We have the online modules. But it's this material is not always easy to just read on your own and then interpret it and go out there and try to use the principles and the skills. So there are actually 4 training programs that some of them were self-funded. LaGuardia College, which gives their own college credits even. And all of them provide paid internships. Northwell, Zucker Hillside, the whole Northwell system, they had a huge need for peer specialists in all of their hospitals. And so they actually established their own peer academy in order to source their peer specialist staff. Now they open it up to the entire public and not only get jobs for people in their hospital system, but in other places. Same with our New York City Health and Hospitals system. Started their own training program, and that is to actually supply their own hospitals with peer specialist staff. So we are very fortunate that we have those resources. They're all free. Certification is free, which is different in the substance use world. Training can be expensive, and so is certification. So I think that the best way to expand the workforce is for you folks who are working in the field, providers. The best source is the service recipients themselves, inspiring them because Asians are always interested in work and a career, and that this is a possibility, that there are a lot of jobs in the field, and so I think that is a way to really expand. But we need every provider who touches a patient, a service recipient, to speak about that opportunity so that there's like hope and striving for a real future, which is critical. And then I think that also what's important is if we really want to expand, especially in the Asian culture, we have to help people with their, not only the public stigma, but even more importantly, the self-stigma that we carry is just a huge burden. And there are now evidence-based practices. We are actually funding a program to help young people tackle their self-stigma using cognitive therapy, in fact. So that is also, I think, providers, it's important to be able to help a person with their self-stigma in order to get to the point where they can think about using their lived experience to help others.
I'm going to introduce you about State Hospital along with LMHC and City Hospital. We have two different systems being as certified specialists. So we as a peer, we don't have doctor degree, we don't have master's degree, even bachelor's. We only require to have high school diploma, to get into the training. So after get a job, then we as a peer require to get certification as a certified specialist. So the hospital, along with UNICEF, we need to have certified, New York State certified specialist certification. On the other hand, the city hospital, they have a different setting of certification. So we have two different, state hospital and city hospital.
So we are working on expanding the peer workforce with everybody here. At the same time, we want to know what is the current compensation, how we can compensate our peers at all over the field. I think in recent years, all peer services just become Medicaid, billable services.
So when we transitioned to Medicaid managed care in 2016 and made peer support services Medicaid billable, that's when providers became really attracted to hiring peer specialists and generating revenues. And unfortunately, because of the shortage right now, the market is handling sort of driving up the compensation. I was pleasantly surprised the other day to even hear from a peer specialist that the starting salary at the clinic operation, a fairly large clinic, but was starting at $75,000. I was like, wow, I knew it was driving up the salaries, but it was not that much. So I was really pleasantly surprised by that. And now compensation is, rising at all different places. I want to say at the beginning, actually, one of the best compensation packages and movement in the going up into the supervisory management level, New York City Health and Hospitals is excellent. They were the first ones to offer a very high salary. They're the biggest employers of peer specialists, and there is also different levels of peer specialists, sort of supervisory and management level. So I think it's also what's needed, and it's difficult to do in the peer specialist field, is more research, controlled trials need to be conducted. But because it's difficult, what needs to happen is really sort of honing in on special sort of services. So maybe comparing ACT teams or local crisis teams with those who have peer specialists and those who don't. Being very specific and controlled in their research is critical. And the more that providers understand the value, the more that I think they'll attribute sort of compensation to it. I also think that a lot of peer specialists complain about not having respect from licensed clinicians that they work with. And a lot of that has to do with the clinicians not understanding what education is involved in becoming a peer specialist. I always used to tell the students at Howie the Heart, and using your lived experience or having lived experience alone does not make you a quality peer specialist. Okay, that training, the content of that training, how to use those skills strategically, intentionally, and the documentation, really developing a customized treatment plan for that individual and really progressing on that. All of these technical skills, not very different from what social workers have to also study. And those skills are, critical to being a good peer specialist. So the more respect that is garnered from the field, I think the more the compensation will also have to change.
When I try to have a job at EPC, Bronx Psychiatric Center, first question they ask me, are you in mental health issues? Are you sick? If I say no, there's no job there. So that time I must say yes. I'm having mental health issues as a bipolar, as myself. And also, I have a hard time to do continuing education in order to keep the certification as certified specialist. Still, I'm having a hard time because of English kind of barriers. So when if I study, I just try to study by myself. But my co-worker I just ask her to help me get through. It means she's not giving me the answer, but we need to discuss each other to get through. So it makes me easy to get through. So still, I need support for English level. On the other hand, I went to Canada University for PASS and GED classes. That time also, English was advanced. So I took a GED exam, math and science, I passed already. But I took once the social study exam, I failed by 4.5 points. That was my point of failure. Not even 1 point, 4.5. They give me that score. So. But after that, then I went to school in LaGuardia Community College for fine art major. And then they told me that you just need the transcript from my college diploma from South Korea to school. So my school in Korea to LaGuardia College, then it's going to be okay. So I aim high for my major now as a fine art. To me, the art is wrong, but life is short.
Thank you, Celina, Yumi, and also Yumiko for your presentation.